It's not going to be just one time. It's not going to be just a one-time thing. So that recording will be available to everyone, as well as contact information for all of us. Um, and as I mentioned, it is our sincere hope that today will spark some ideas. It'll spark future collaborations and it'll spark inspiration in each of you and each of us to keep doing more. Because as all of us that are in the world of nonprofit know, as much as there are resources, that gap continues to expand. And so we need as much resources to be put out there as possible. So everybody has a role to play, even if you think it's very small. The small ones matter too. So let us get started with our speakers. I'm going to just do a quick introduction and then I'll come back to each of you and have you do a little bit more of an in-depth introduction to yourselves. Our first introduction is going to be for Dr. Marnie Stallman, who is the president and CEO of the Mental Health Association of Central Florida. And for those of you that may or may not be aware, May is Mental Health Awareness Month. And so flash your green, show us your support. Yep, there you go. And recognize that mental health issues isn't some sort of thing that happens to other people. We're all dealing with it in some way, shape, or form. And that's one of the hardest things to do is to break that ice in terms of how to start that conversation. I'm actually giving a talk later this evening on issues of mental health specific to the South Asian community. So it doesn't matter. Black, white, yellow, brown, male, female, other, we're all dealing with it. So thank you, Marnie, for taking the time and being on with us. We also have Nicholas Abrahams, who is the president and CEO of the Winter Park Health Foundation. And he's going to be talking to us a little bit about nonprofit strategies for expanding healthcare access. And then number three, we have sorry, I lost my page here. Number three, we have Dr. Deborah Andre, who is the president and CEO of Community Health Centers, a great organization here in town, really boots on the ground for creating that access to healthcare. And she's going to be talking to us a little bit about a physician's role in advancing that health access. So thank you for being with us today. We look forward to hearing from you and getting some questions from the community. But first up, let's have Marnie Stallman speak to us on mental health solutions for the underserved community.
Thank you for having us here today and for bringing this esteemed colleagues and groups together. I'm especially gratified to be included with this important conversation, and has been noted that this is Mental Health Awareness Month, and I've never been accused that I can't have a conversation when it comes to talking about good mental well-being. So as the president and CEO of the Mental Health Association, for the past almost 36 years, I've been very deeply committed to advocating for mental health resources and access across all specters of our community. And that's because I've seen firsthand how critical mental health is every day to the aspects of our own individual well-being, both as a mom, both as an individual and colleague within my community, as a wife, as a daughter. And we just sometimes really need to take stock in that. My passion for this work is really rooted in the belief that mental health should be never treated as anything separate from our physical health, that they are intertwined, interlocked, and hand in hand a partnership with each other in terms of how we view and how we live our lives. I'm especially driven to ensure that we address the full spectrum of challenges that our community and its residents face, which is also recognizing that housing, food insecurity, legal issues, education, many social determinants of health are often tightly linked with our mental health struggles. I'm especially passionate about youth mental health and suicide prevention. And here at the association, we drive a program called You Are a Lifeguard, which is especially near and dear to myself and to our family. And my goal is to make sure that no one in our community has to face mental health challenges alone, and that everyone, regardless of their insurance status or income or documentation, has access to compassionate, effective care for their well-being.
Thank you, Marnie. And I couldn't agree with you more. I think separating mental health and physical health has actually done humankind a disservice. It's allowed us to put them in different compartments when they really can't be, and it's allowed us to marginalize mental health as just a problem of your will and your, determination, and it's unfortunate. And I love the fact that you're saying that separation needs to end, and we need to put them all back together as a whole person, as a whole entity. So that's amazing. Um, Up next, we are going to hear from Nicholas Abrahams on the nonprofit strategies for expanding healthcare access. Nicholas.
Hi, Bina. Thanks for having me. So excited to be here, especially with two community champions like Deborah and Marnie. I am the president and CEO about 9 months of the Winter Park Health Foundation. So I've learned many things in the 9 months, but one is that we have two amazing partners on the screen with us here today. Winter Park Health Foundation for the past 30 years has been serving Central Florida, specifically the communities of Eatonville, Maitland, and Winter Park. We are a grant funding organization in the space of health and well-being. I wake up every day excited to work with partners, whether it's our nonprofit partners or our for-profit partners, to really advance the community. It's what I have a passion for. Before this, previously serving with the Orlando Economic Partnership, but just knowing that, community development is economic development, is public health, all about just how do we continue to move our community forward. And really, here at the Winter Park Health Foundation, we're focused on being a good partner, being a catalyst, a convener, using the roles and the opportunities we have as a funder, a different role. Bina, we've got the screen split, right, as two funders and two providers. As a funder, what our role is in the community to best serve our partners. And so excited for the chat, but more excited to hear from, Marnie and Dr. Andre here on what's ahead.
Thank you, Nick. And I love the perspective, right? For you to having come from the economic development side of things and seeing how much Orlando has changed and Central Florida has changed, but then at the same time recognizing that there's the philanthropy side that we need to not lose
Yeah.
focus of either. And I love that. And I remember when you and I had a conversation, you had talked about how there was conversations happening about collaborations, but then COVID kind of happened and everyone went into their own little corners and siloed off. And now the conversations are starting up again. So super
Yeah.
excited that you're here and that you're one of those champions getting
Oh,
that conversation started.
it's very kind of you.
Next, I would love to introduce Dr. Deborah Andre, who is the CEO of Community Health Centers. She's going to be speaking to us about the physician's role in advancing healthcare access.
Yeah, thank you, Bina, and thank you, Marnie and Nicholas. I know that we jointly have many projects over the years that we've worked on. I'm CEO and president of Community Health Centers. We are an organization that's been around for over 52 years now, serving Central Florida. We serve everyone, regardless of ability to pay, and that is in primary health care. So pediatric care, family care, internal medicine, OBGYN, optometry, behavioral health, pharmacy, and lab. So we have about 68,000 patients and we do about 250,000 visits a year, 200, 250. So we are one of the largest federally qualified healthcare centers in Florida and one of the largest in the nation, which when you talk about access to healthcare, I think some of the points I just highlighted really show that, we take anyone and it is in areas where it is hard to find other healthcare providers. We do break down barriers to care, which I'll talk about a little bit later in the session. What keeps me up at night is that there are so many in need and just how to do that in a sustainable fashion. And what really inspired me to do this is to relieve the suffering of others. Beyond the mission of my organization, that was a mission that really spoke to me from early childhood. And through my journey as a nurse and as a physician and a board certified pediatrician and my work with this company over 23 years, just really proud of what our company does and the work we do with our community partners and the service that we provide to all the patients over the years. So just very grateful for this opportunity and to Bina for starting this alliance that, when I first spoke to you and you highlighted about wanting to give back, that's very, very meaningful to my organization and it really inspires us to keep doing the work that we're doing. So thank you.
Thank you. And for those of you that don't know, being designated as a federally qualified health center is no simple task. It is a monumental task and a huge designation, but a huge responsibility because you are really ensuring that you are going to care for just about every aspect of an individual in all ways possible. And with that comes, it's an incredible task to try and keep all of those plates spinning. And so what you're doing is incredible work, and to be that big of a FQHC is no easy task. So
And
thank
and Bina, I know you said kind of casual, but when you have the opportunity to walk into CHC and you see the care that's being, given to the community from Dr. Andre and her team, you can't help but leave motivated. I mean, it is all care that, we would accept, and as individuals, we should be aware of. And it's really something that, Dr. Andre, you shared a little bit on your background, but you're the perfect person for that role of, being a pediatrician, seeing you sit down and put a smile on a child's face, or, calm a family in a moment of need. It's a powerful message.
you. Thank you.
And I think that's important, right? When you said it's care that we would all accept, meaning it's dignified. Simply because you're uninsured or underinsured, it doesn't mean that you're cattled through and cared for in just some slipshod way. It's dignified, and it's that speaks highly. So it's amazing. All right. You guys excited? We're going to have some conversations now about what we're really here to do. All right. Marnie, what are some of the most significant mental health challenges that is facing our underserved communities in our region? And how is your organization specifically attempting to address them?
Yeah, so I would say there are actually two that I think are the top when I think about them. The first is understanding how to access services. So frequently we see our communities, organizations, for example, in the Winter Park Health Foundation, our government entities, really supporting and robustly trying to curate in the nonprofit sector the mechanisms for services to be delivered. And we hear repeatedly from our community members, our neighbors, that they're not aware of where they are or how to access them. So it's not necessarily that our community doesn't have the resources. I think we do. I think we're very robust. And we've had a lot of investment for a long time now in making sure that that's completely filled out. But I think it's how do the disenfranchised, the folks that are in minority communities or communities of disparities where we have seen these social determinants really have strong negative effects get and the information that they need to access. And then the second that I would say to that, and I know I see that we've got Rebecca Sayago, who's the executive director for covering Central Florida in the Primary Care Access Network, with both Dr. Andre and I enjoy being board members of it and proudly part of PCAN, which was started over 25 years ago here in Orange County. It's the folks in our community that don't have health insurance that are particularly suffering from not just understanding that there is access to services at organizations like mine and Dr. Andre's and other FQHCs in the community, but that they're suffering in silence because they don't believe that there's access for them. So those would be the two for that. In terms of how we address that, we're proud here at the Mental Health Association, as I've already said, to be a member and a partner with PCAN and the member agencies that service the uninsured and underinsured here in Central Florida and try to provide coverage. But specifically at our Outlook Clinic in downtown Orlando, we are here to provide mental health services at no cost, free, to individuals without health insurance that are at or below 250% of federal poverty guidelines. And often that's done in support of organizations like the Parikh Giving Alliance, the Winter Park Health Foundation, Orange County Government, Central Florida Foundation. There's just a patchwork and a quilt of organizations that have helped to support the work that we do here at the Outlook Clinic, where we're now seeing almost 300 patients a month as young as 6 years old.
Wow.
Mm.
Wow. Marnie, how does so that's it's an amazing statistic that you just gave in terms of the free services that you're providing there. How does someone that may not necessarily um, qualify for those type of services, the free services, how can they access? Because I think, as we mentioned earlier, mental health doesn't pick and choose who they're going to go to, right? And I think whether you're middle class, upper class, uh, low income, it doesn't really matter. How does someone that may not necessarily feel like they can qualify for that still reach out to you, and what kind of services are offered then?
Great question, and thank you for that. So one of the programs that we're really proud of here that has been going on since 1995 at the Mental Health Association is a program called Connections, which is our version of an information and referral resource database where we now have over 4,000 community providers in Orange, Osceola, Seminole, Lake, and Brevard that we curate. And what's unique about the work that Connections is done is it's answered live by master's level interns from our neighboring schools like UCF, Rollins, and Stetson for practitioners that are looking for experiences. So they're qualified and working within the clinical mental health continuum. But what we do is we do a deep dive in what is specifically the issues and what are they looking for. And then we go into that database. We'll call the folks that match it to find out if there's appointment availability. Because one of the things that we know is, in addition to the access issue, when they do find someone, there is a great stumbling block, an impediment, if you will, about getting an appointment.
Mhm.
And so we do the work on our team's end to see if those individuals we've matched them to have availability, and then we'll call the individual calling back. So we really are open to anybody calling us, whether it's for themselves, a family member or colleague or friend, or pointing somebody directly to us to make that call themselves. We do the match, we curate it, and then we come back to the individual and we say, this is a match, and here's who's ready to take you in as a client that meets your criteria.
That's amazing. And then how do they, from a financial standpoint, is that something that you facilitate, or is that something directly between
It
them?
depends on what their resources are. So some individuals call us and they have full health insurance through Florida Blue or Aetna or United Healthcare, or maybe their employer has an EAP and they're trying to find those resources. Or if they don't, they can come to us at the Mental Health Association. You know, that 200% federal poverty guideline for a family of four is about an annualized income of about $95,000. So
Mm.
it really does capture, and we function at the association through the Department of Health, through the state of Florida, through something called the Volunteer Healthcare Provider Program, which helps us to create those criteria of what are the stipulated financial criterias. And if they don't meet those, we have, as I said, a very robust network of individuals that we reach out to. Sometimes we'll call into Dr. Andre's team and make a referral directly. And because we also know that they're coming to us maybe for their mental health conditions, but there's always almost uncommonly, unfortunately, primary medical conditions that are accompanying those issues or specialty care issues. We often have individuals that are calling us that have recently been diagnosed with cancer and don't know where to get treatment or assistance for that. And of course, there's mental health, anxiety, and depression that goes along with that.
That's fantastic. That's fantastic. Thank you so much. Um, Nick, what role do you believe that nonprofits are playing in bridging gaps in healthcare access? And what strategies
Oh.
have you seen has been the most effective in addressing this disparity?
Okay, do I have the next 30 minutes? I get the rest of the
In
word?
in
No.
20 words or less. No,
In
go
20
take
words or
all the
less.
time you want.
Yeah, I saw the, keep it short in my notes. Um, I think so much of this, it's been a unique time of coming into this role, but even as Marnie was speaking, right, I'm sitting here and writing. I think the role specifically from the funder standpoint is to constantly be educating ourselves on the resources that are available to our community, right? She had mentioned it in her opening remark or just her remarks there, but it's knowing that, that network of connections is there, right? It's not as a funder not thinking, I have the best idea in the region. It hasn't been done before. Here you go, community. Be lucky that I provide down to our nonprofit partners. It's working with the experts, right? And I have two here on the screen with me right now that are seeing day to day what the community is facing. We've got a lot of great existing work that's being done in the community that's been done. The Winter Park Health Foundation was one of the original funders on the community health needs assessment. So we have structures that are there, but it really is going back and saying, like, what are you seeing right now? What are you addressing? Marnie and I have had some conversations separately during breakfast where she was bringing me up to speed with her role with Orange County Jail, right? And what Orange County is facing there from an unprecedented standpoint. So I really think that we, you and I sitting on here from the funding perspective, our responsibility and our job is to help our service providers every day. Sometimes that's going back and looking at the historical funding that we've done ourselves. We've invested about $131 million into our communities that we serve. That's fantastic. But our community looks completely different from 2025 than it did in 2000. We've had 1,000 people, a week moving here, and Orlando's just continuing to grow. So those problems are growing. And so it's really, I believe, our job to help those partners, sit down with them, educate ourselves on the challenges that they're facing, understand where we as an organization can, and then where we as an organization can't, right? I'm an organization with it's great that we have a fund that is benefiting the community, but it doesn't end with a billion at the end of it, right? So we have to be very intentional with the dollars that we serve. We have to use the boards that we sit on. We were joking before this started about, kind of what's the next meeting, and the next meeting I serve on is a board in which we are making grant recommendations to the community, and we have to take that knowledge that we've gained only impacting the grant making that we do about, you said you've only been, doing this for 5 months, right? But anyone that knows you knows that that's just when the IRS gave you a designation, right? This has been your commitment and your impact to the community. So it's taking all of that knowledge and really trying to understand where we can best be a catalyst rather than trying to be the expert ourselves.
Collaboration, right?
Yeah,
Because
100%.
yeah, we're not going to change. One person isn't going to change it all. And reinventing the wheel is not my cup of tea. I'd rather, partner up and do something together. So that's a great point. Dr. Andre, as a physician, what are some of the most common barriers that your patients are facing in accessing quality health
Yeah.
care? And what are some of the systemic changes you believe are necessary to address those issues?
Thank you for that question. And thank you, Nick and Bina, for recognizing that we have to look back at historically and see what's worked, what can be improved upon, and how do we best collaborate together. So I appreciate that, especially as we continue to partner. Very much needed. And I think that is key to moving the needle here. But I think Marnie touched upon something when she said the access is there. I do believe we are a little bit spoiled here, thankfully, in Central Florida, especially when I talk to my colleagues around the nation. So we do have the access, but it's about for many of our patients, and Marnie can probably identify with this, they have what I'll call our competing priorities. Some people may call it a decision that they wouldn't have made or not high importance, the other thing that they've decided to do. But for example, if they have to source food, get kids to school, show up for a job interview, show up for a court date for something, it can be, competing for their time, for their energy. And I think it's great when we kind of shift our paradigm to look at what we're ascribing to someone or to a various population may not be at all what they're thinking. And that just leaves everybody frustrated and pointing fingers. So I think it's really important to get to know your patients and your populations on an individual level and then a systemic level. And when you do that, you can really move the needle. And I'll give you just two quick examples. I see some of the folks from our organization on also. You know, sometimes when I talk to patients about a vaccine, for example, the HPV vaccine, immediately they think certain things. But when I talk to them about, I would like their grandchildren to be born healthy, all of a sudden they want that vaccine for their child. So it's just putting it in a frame of reference that's meaningful. Another example is I can talk to folks about smoking all day and the effects it will have on your lungs and cancer. And that just seems very distant and far away, and they're not going to get cancer because they're young and vital. But if I talk to them about wrinkles, oh my goodness, nobody wants wrinkles from smoke. So then all of a sudden it's like, stop the press. Maybe I'll stop smoking. Those are just two examples. But, you know, how do we make sure that we keep patients out of the ER and prolonged hospitalization if that's not where they're supposed to be? You know, first, we want to make sure they have that primary care connection. Marnie touched on it. Do they qualify for the sliding fee discount based on those certain qualifications? Can we connect them to a payer like Medicaid or Medicare? And we have lots of workers in the community that can help connect them to that. But then, do we have appointments that are easy to access? We offer appointments during non-traditional hours, Saturday, evening hours. You can make it appointment by phone or in person, online, or one of our partner organizations can refer you over to us. I know the PCAN network has a brochure with all of those organizations and their hours. And then, do the patients have transportation? Can they walk here? Is it raining? Is it lightning? It's interesting when that occurs, we have a higher no-show rate. We do have a no-show rate every day of at least around 20%. And then we have a rescheduling rate because they have to reschedule for whatever reason. So some days for some providers, that can be 40% of what lands on the schedule doesn't come to fruition. So we have to overbook and overschedule. And you can imagine there's always that day everybody shows up and there's always that day nobody shows up. So we have to learn within our system of how best to come to a happy medium. And most days we do. But then we have to make sure that they can get to us, whether it's a bus pass or Uber medical. We're looking into that. Uber medical transport. Is it Medicaid transport, which you usually have to arrange so many hours in advance, which can be troublesome if you don't know you're going to be sick tomorrow. And then we have to make sure that we speak the language that you speak. So we have a translation service, and I can tell you it is tens and tens and tens and tens of thousands of dollars a month just in our translation services that we provide to all these patients. And then individual messaging from all of our providers when they make that connection with the patient, why they need them to show up. That alone can probably catapult you more than all the messaging in the community because it's that relationship. And that's what we do. And we try to build at community health centers is those relationships with our patients and their families. And then when they are here, we try and close as many care gaps as they can, give vaccines, do all the screenings or refer them on for any needed care. We also connect them. I think Marnie touched on this. Do they need connection to food? Do they need connection to Orange County or something else within the PCAN network, or in Lake County, it's a different network. But to say that we'll ever be done or check completed, we will not. And that is what inspires us is the ongoing work and the impact that we make. So it's never one and done, and you will see us out here for at least another 50 years continuing to do the work that we do with the support of great folks like you all. So I thank you for that question.
Wouldn't it be lovely if we could say it would be done, and that
Yeah.
our services wouldn't be needed, but I think that's not going to be the case. Dr. Andre, what do you see in terms of, when patients are coming, is it easy? Is it hard to create that relationship? Because you talked about needing to make that connection. Do they come in wanting to trust you and be a partner in their health, or are they coming in sort of
Yeah,
defensive and
99 out of 100 times, it's one of the great privileges of my life being a provider and being so invited into someone's, the most intimate details of their life and laying hands on them. I will never, ever minimize that privilege that, a hard-earned privilege. But we do have some patients who have been treated differently by other organizations or other countries or, you name it. And once they see that, we're here to help them, that's the message that we start with. You can quickly see the defenses fall. A lot of times, I remember one gentleman, he took 2 buses and had a newborn, and the mother was sick at home, and he forgot diapers, he forgot food, and he was just sweating when he got up to see me. And he thought, I'm late. I know she won't see me. It's okay. I'll make another appointment. I'm like, absolutely, we'll see you. That is what we're here for. We're not here to make your day harder. If you try, I know how hard it is to travel on a good day with a newborn, with all the help in the world. But there's just so many mission moments that we have at community health centers, and you can see online. Our website is there if you ever want to contact us for an appointment or to apply, or someone out there in the community looking for work. We have many job opportunities and educational opportunities, but yeah, that's I think when I talk to our team members, it's the great benefit of working here is those individual relationships. I'll walk into a center and they'll be like, oh, that's Mr. Jones. He's coming in. He comes in every time this month to pay his pharmacy bill. And he takes care of his mom. The amount of detail that they know about our patients, it just never ceases to amaze me. I was in one of our centers and the lady at the checkout desk, she called, I'll just say Mr. Brown. Mr. Brown, come on up. And I'm like, how do you know his name? She goes, oh, I know most of our patients' names. And we have thousands of patients that come through our centers a day. So it's quite remarkable when you break it down to those individual relationships that are going on. That for me is key. If we don't have that, we don't have anything.
and I
But
love what you said.
isn't that
Mission moments are, that's an amazing phrase, and I love that.
Thank you.
sorry to interrupt. I was just saying, isn't that beautiful though, right? Like when you sit in the waiting room at like an FQHC and like you have this conversation, you see that like passionate case manager, right? Because like let's be honest, like, the person who's working in that role, they're not going to be a billionaire one day, and they just care. And it is so beautiful to see that energy of serving others, right? It just comes out and that's kind of what I shared at the beginning, Dr. Andre, is like when you walk in there and Mr. Brown gets called up there. And sometimes at one that I was at the other day, Mr. Brown wasn't happy, right? Mr. Brown's prescription had been delayed and something like that. And they're just treated with respect and care. And it's a beautiful thing.
The right kind of infectious.
Yeah.
All right. Marnie, can you share some successful strategies or programs maybe that you've um, been able to see, implement that has improved access to mental health services? Oh, sorry. Hold on. You're muted. Can you?
There we go. I'm sorry. That
That's
was
okay.
my fault. So I'm sorry. Can you repeat the question again?
Sorry, yeah. What can you share in terms of what successful strategies or programs you've been able to either see or implement that has helped improve that access for mental health services for some of those marginalized patients?
So I am a very staunch believer, and I would dare say I probably are, my esteemed panelists would probably say that they are as well, that the best work that we can do to make impact doesn't happen in our offices. We have to go into the communities. And that's something that for the last 5 years here at the Mental Health Association, I have really strategically tried to encourage our team and deliberately make choices about where and what we collaborate on so that they are facing forward into the communities where we can access individuals. We know that our community is really strained on transportation. I think that all of us would agree that in the conversation about access, it's not just getting the information, but it's how do they get transported to the locations where the actual services are available to be delivered. And what a roadblock that is. And that's why I think one of our proudest achievements that I think is that as you move into that dynamic and that mindset about being in your community, you look for effective community collaborators and individuals that may already have a presence there that can act as an entree or as an invitation or an individual that can help that community welcome you in and not see you maybe as a foreign entity, which when quite frankly, let's be frank, when we're talking about mental well-being, we're talking also about breaking down perceptions around stigma, as you've already said, and that difficulty that people inherently have about stepping forward and announcing and being more public and candid about the struggles that they may have with their activities of daily living that are being affected by not having good strategies and adaptive coping mechanisms for how to manage our feelings that then influence our behaviors. And so we have to go into the communities like the Boys and Girls Clubs and Big Sisters, Big Brothers and Salvation Army and Christian Service Center and high schools. Quite frankly, my daughter is a junior at Winter Park High School. We know that the foundation has been a big investor in the services in the Maitland, Winter Park, and Eatonville communities to try to rise up and bring awareness in these communities about just general health services as well. And so that's my long answer to your short question about what have we seen and done to be effective. And quite frankly, it's something that from a strategic standpoint is always at the top of my list when we are deciding about what we're going to do, where we're going to ask for investments. And I love that word, Nick, because that's what we are. We're asking for you to come alongside us as investors, not in us, but in our community, and utilizing us as the vehicle by which we bring those resources and strategies into those areas where they previously may not have had that opportunity.
And that ROI is, immeasurable in terms of when we make that investment. That's
Well,
nice.
you know where that ROI comes in? That ROI comes in from a kid that is at Hungerford Elementary, and that's where they started their educational career, and now they're a super scholar at Winter Park High School, right? And they're healthy, and their family is well adapted. Or it's another indication where you've helped a family that may be impoverished to the point where they're homeless and they're living out at the Salvation Army, and we're working with a mom about postpartum and maternal child health and how to lift them up. Or we're recognizing an individual that may be at one of our community partners like the community health centers where they're grappling with a cancer diagnosis, and we're providing a support group on grief and loss, or a women's support group that's completely done in Spanish so that we're being more culturally competently aware that we have to communicate and speak languages that may not be primary to us.
Yep. Thank you, Marnie. I appreciate that. I'm aware of our time, so I want to just ask one more question. Nick, and this is going to be probably for you and me, in terms of as nonprofits, how can we better collaborate with our community partners out there, and policy makers to create those sustainable solutions?
Well, this goes back to Marnie. I'm sharing the details of our breakfast from a few weeks ago. Um, we as funders have to be okay with some of our partners trying new things and trying to innovate programs and new partnerships and coming back and saying, hey, that didn't work. We tried, we thought it was a great opportunity, but it didn't work, and that's okay. And that's, I mean, that seems simple, right? But it has to be a trust that's built into those relationships that rather than me putting 15, barriers for you to jump through as a nonprofit organization to prove that you're a good steward of those dollars, we have to work with you. It's a two-way street so that we can try new things that are as the region and our communities that we serve continue to grow, those challenges are also going to change. And we need our, nonprofit providers to feel comfortable with funding opportunities that not only are we going to continue to, do the services that Dr. Andre is sharing, but then also for Marnie to come to me and say, hey, I've got this idea. There's two partners. We think we have something here. And the Boys and Girls Club example was something that you had shared with me at breakfast, Marnie. There's no guarantee that some of these things are going to work, but as long as we have that same similar North Star and we feel comfortable with those relationships, it's that kind of industry migration to trust-based philanthropy in many ways. I think that makes us a better community partner. And so it's continuing to build that trust with our partners, but then also maybe removing some of those traditional barriers that our providers are seeing that we think there's good intent behind them and they did serve a purpose 100%. But when I'm looking at my FQHC, Bina, you had mentioned it, to get to that level of detail that they have to do with the federal government, with the state government, with the local government, you know, I imagine that those barriers and those requirements are much more strict than my individual grant application and the paragraph that I'm asking them to go through. So it's really taking a look at ourselves and saying, are we making sure that we're being a good partner in this relationship?
And I love that expression of trustworthiness, and the hand-in-hand collaboration between the funder, the deliverer, the partner that's bringing the services, and the trust to the community that instills. And I think that's always when we look at the folks that we're trying to create impact for, that we're trying to extend a hand to lift up towards. When we talk to them, one of the things that I think I hear more often than not, and Dr. Andre, I'm sure your team does as well, is the sense of feeling like they're disenfranchised, that they're not connected, and that element of feeling that connection, as you brought out in your description, from the person that's in your lobby doing the greeting to the practitioner that lays hands, it's an expression of trust, and an expression of sincerity. And to have that with funding partners, I think is just critically essential.
And it goes, to our government partners too, right? From the standpoint of, I have the privilege of serving on the Habitat for Humanity board. And I think they've done a great job with, as they call it, the Face the Housing Challenge, right? But redefining this narrative that's being used throughout the community, right? This is your child's teacher, right? That is having this challenge that they're facing. Bina, you had mentioned mental health knows no socioeconomic status, knows no geographic location, right? These are the folks who are, working alongside you in your offices each day. And so it's really to our policymakers sharing that narrative in a different way. I had the opportunity to work in the state legislature for about 10 years. And when a community came together and you could see all three, private sector, independent sector, public sector together facing those challenges, those were the communities that then were invested in from state and federal tax dollars. It's extremely powerful.
Thank you. Paula, do we have any questions um, from the attendees today?
Yes, Bina, we do. We have quite a few. Let me just give me 1 second and let me find. Oh, there's so many great ones.
Oh,
Okay. Let's do this one. This could be for anyone, but it looks to be specifically targeted for Marnie initially, and talking about, in general, about the work that is being done with municipalities such as Orange County, City of Orlando, State of Florida. And Marnie, you had said something about working with the Orange County corrections. And so the question was just in general, how do we work with those municipalities? And specifically, I think that was very interesting to the
How
person
we
else.
got involved was really, it has been a strong collaboration that we've enjoyed now for over 20 years. One way is to pay attention, and Nick made mention of this as being one of the principal funders. The foundation has been an investor, and I know Dr. Andre participates in it as well. The Community Health Needs Assessment, which is now out, which is a requirement every 3 years, is exactly what it says. It's the Community Health Needs Assessment. What does the community need? And our government partners here, whether it's local municipalities, and remember here in Orange County, we have 11 municipalities, right? So they all have different initiatives. It's not just Orange County government or the city of Orlando. Don't forget City of Winter Park. Don't forget Windermere, Belle Isle, Apopka, Edgewood, they all have unique issues that they're functioning with that intersect into the conversation that we're talking about, particularly with homelessness and mental health resources and primary care work that they're doing there. So my first piece of strategy suggestion is get a hold of the CHNA, and it's available. And if you need it and don't or want it and don't know where to look for it, contact me. I'll put my, Paul, please put my email address into the chat and I'll be happy to send it to you. I know Nick will, Dr. Andre, we've all been participating in this. And it is a roadmap that not just our municipalities look for, but also our funding organizations about what is our community telling us they need support in. And it's assessed every 3 years, and we all participate in it, and it's an exhaustive collaborative process to get to the nuts and bolts of what are the particulars, and then how do you as an organization possibly fit within the guidelines of what the community is telling you is a primary priority for them, either right now or over a prolonged period of time. And I'll let my colleagues answer if they feel that's a good first step.
That was great. Read it. It's a beautiful read.
It's a long read. I think
It's a
it's a
long
couple
read.
hundred pages.
Long read, but it's a beautiful read.
And it will cover Orange, Osceola, Seminole counties and Lake.
And like,
So we know that there are some folks on with us today that may have a reach beyond just Orange County, and it will include that.
Amazing. Thank you.
We have one more that if you have time, do we have time?
Let's do one more.
Okay, yeah. So this is sort of a summary of quite a few, but in general, the general notion of these is along the lines of how the hierarchy works in terms of. It sounds like a big question, but how the hierarchy works in terms of who's provided and who then would be the most vulnerable, who's the most underserved. Is that even anything that we could answer in the time we have here today? But that seems to be the culmination of quite a few.
Well, that is a big question. I can tell you there are many needs that go unmet for various reasons. But if you want to look also besides the things that we've already mentioned, adult dental care for uninsured is one of the largest unmet needs in the country and in this state. I think my chief dental officer told me there are 500,000 people just in this Central Florida that are in need of an adult dentist. We are part of the answer, part of Central Florida's solution. But when you look around, there's not many folks who are able to come to the table and offer those services at the reduced cost that we offer it. So that is just one population in need. And it's an evolving landscape, right? We had Medicaid disenrollment. Lots of folks now went to different systems that provide a payer, or they went to uninsured. So what you were, as Nick mentioned, 5 years ago may not be what you have now. So those needs are constantly changing, and we have a changing political backdrop with what's funded or what's we're told may or may not be funded, or what new stipulations are. And that is where, as a healthcare organization, every day we're meeting, we're discussing, we're sending policies up to the board. We're going to Tallahassee, we're going to Washington, we're working with our state PCA and our national PCA called National Association of Community Health Centers to try and make policy changes at the federal level and at the state level. We win some and some we try again next year. And I know you all do that work too. I see many people on the call that are involved in some of that work. I think we every day wake up and put our best foot forward and know that it's not easy work, it's challenging work, but it's some of the most important work. And I think it's very purpose-filled. We are all very mission-driven, at least everybody I've met in this community. And that's what keeps us going and will sustain us through all of the challenges and the hurricanes.
Thank you, everyone. I really want to be mindful of everyone's time today. I can't thank you three enough for all of your valuable insights and your perspectives that you've brought to the table here. Nick had shared with me earlier that something that made my heart sing. You know, one of our main purposes of doing this is to make connections, to make this feeling of that we're not out here alone, that we have partners that we can connect with. And because of this conversation, Nick and Marnie have been having conversations and have been able to expand on their relationship. And that's exactly what we're trying to do is do that. So we encourage each of you to continue these conversations. Your resource kit, as I mentioned, will have all of the information from our recording today, contact information as well for all of our speakers today. Join us for our next collaboration circle, which will be in August, and that will be on education. And we have another three amazing people that are going to be speaking to us. And then in October, we will be doing our arts collaboration circle. And then in the meantime, we're also going to be doing in August our second round of grant gifts. So we're super excited about that. But again, thank you all for joining us today and making our community healthier and better.
Thank you.
Thank you so
Thank
much.
you.
Go ahead.